I'm cancer physical therapy's expert, Dr. Leslie Walke. Here at the Recovery Room, we know that your time as a cancer patient or survivor is super valuable. So to help out, every once in a while, we will do a recap of the key information in the previous 25 or so videos. So basically, we're binge watching for you. Tie your shoes and fasten your seatbelts because here we go. In the last 25 or so videos, we have learned that the Recovery Room is a question and answer platform on Facebook and YouTube, specifically for you, cancer patients and survivors. Cancer treatments such as chemotherapy, surgery, and radiation are all life-saving, but can have profound negative effects on physical health and well-being. That is where cancer physical therapy comes into play and can help prevent, eliminate, or reduce those symptoms. So if you don't have a physical therapist, you should get one. Living with long-term pain or fatigue is not okay. As a matter of fact, it is never okay to not be okay. We've learned that lymph nodes act as filters and can trap stray cancer cells, which is why cancer doctors will remove them to look for the presence of cancer cells so they can create a treatment plan best for you. Lymph nodes also help fight infections, so with fewer, you can be at risk of getting a type of infection called cellulitis in your involved arm or leg. The 4 warning signs for cellulitis are redness, warmth, pain, and swelling. Anytime you see any of those symptoms in your involved limb, call your doctor or nurse right away. Lymph node removal at the underarm can cause a condition called cording. If you suspect you have cording, talk to a cancer physical therapist to help make it go away. Lymph node removal can also put you at risk for a condition called lymphedema. We have learned that if you are at risk for lymphedema in your arm, you do not need to wear a sleeve when you fly, nor do you need to avoid blood pressures or sterile needle sticks. The 3 best ways to decrease your lymphedema risk are: number 1, minimize the risk of getting an infection in your involved arm or leg. Number 2, maintain a healthy body weight. And number 3, make sure that the area from where the lymph nodes were removed is fully strong, flexible, and mobile. We have learned that whether you are at risk for lymphedema or have lymphedema, exercise is both safe for you and good for you. Speaking of exercise, we have learned that all cancer patients and survivors, regardless of gender, age, overall health, and type of cancer, should be exercising 150 minutes per week because exercise will improve the quality of your life, may lengthen your life, and even can decrease the risk of dying from cancer. Weightlifting is good for you and should be part of your routine about 3 times a week. When you start lifting weights, follow my 10 to 30 rule. If you can't do 10 reps in a row, what you are lifting is probably too heavy. If you can do 30 reps in a row, it is probably not heavy enough. We've learned that doing push-ups against the wall is one of the world's greatest exercises and almost everyone can do. And that the 4 critical stretches to do after breast cancer surgery are the overhead stretch, the butterfly stretch, the snow angel stretch, and the trunk rotation stretch. We've learned that getting a massage is okay if you have or have had cancer, and the best way to know if you are hydrated well enough is by the color of your urine. We've learned that prolonged sitting is really bad for us and that you should stand 30 seconds every 30 minutes. Speaking of bad for you, alcohol is linked to multiple kinds of cancer and can impact cancer recurrence risk. Chemo brain is a real thing. Chemotherapy-induced peripheral neuropathy is crappy, but I want you to keep moving anyway because it's better to be strong and tingly than it is to be weak and tingly. If you are having pain from taking an aromatase inhibitor, exercise can greatly reduce that pain. We've learned that the growing size and age of our population, combined with people with cancer living longer and dying less often, is skyrocketing the prevalence of cancer across the globe, and we need to take good care of each other. We have learned that my in-laws are not very good at standing on one leg, that I have lots of animals that like to do unexpected cameos, that sometimes I get even the easy stuff wrong, and I'm an expert at stepping on my own microphone. And sometimes I walk into locked doors. We've learned from a woman that became a world champion Ironman triathlete at the age of 72 that it is never too late to change your life. We've learned that you should care for and honor yourself like you are the most important person on this planet because you are. And that you should exercise like your life depends on it because it does. And I hope that you have learned that the Recovery Room is really cool. So please share, comment, like, follow, and subscribe, as it really helps us to continue to reach more cancer patients and survivors, as well as the people that love them. I'm Dr. Leslie Walke, signing out from the recovery room. Happy binging! Let's talk again soon.